Welcome back, future nurses. Today we're tackling high-yield pediatric cardiac emergencies, tough, real-life questions that test how you think under pressure. Drop your score in the comments, hit like if you learned something new, and don't forget to subscribe for more NCLEX-ready sessions every week. Ready? Question 1. Tetralogy of Fallot. TOF. Spell. A 2-year-old with tetralogy of Fallot suddenly becomes cyanotic and dyspneic while crying. What is the nurse's priority action? 1. Administer oxygen by face mask. 2. Place the child in a knee-chest position. 3. Start CPR. 4. Prepare for intubation. The correct answer is 2. Place the child in a knee-chest position. Rationale. 1. Oxygen helps, but position fixes the cause. Venous return improves pulmonary flow. 2. The knee-chest position decreases venous return, which in turn reduces the right-to-left shunt and improves oxygenation. 3. Cardiac arrest not yet present. 4. Airway intact. This is circulatory issue. CliniqueRN tip. TOF spell means bring knees to chest before you bring oxygen. Position first. Question 2. Rheumatic fever. A 9-year-old recovering from strep throat develops fever, joint pain, and a new murmur. Which intervention prevents future complications? 1. Limit fluid intake. 2. Administer long-term penicillin prophylaxis. 3. Give NSAIDs for pain only. 4. Restrict all physical activity permanently. The correct answer is 2. Administer long-term penicillin prophylaxis. Rationale. 1. No relation to rheumatic carditis. 2. Rheumatic fever, rheumatic heart disease from group A strep. Long-term penicillin prevents recurrence. 3. NSAIDs reduce pain but not recurrence. 4. Activity restriction temporary only during acute phase. CliniqueRN tip. Rheumatic means repeat. Prevent repeat strep infections to protect the heart. Question 3. Kawasaki disease. A child with Kawasaki disease is being discharged. Which statement by the parent needs further teaching? 1. He will need a follow-up echocardiogram. 2. We will give low-dose aspirin as prescribed. 3. He can receive live vaccines immediately after IVIG. 4. We will monitor for fever at home. The correct answer is he can receive live vaccines immediately after IVIG. Rationale. 1. Appropriate. Coronary aneurysm surveillance. 2. Antiplatelet dose continued to prevent thrombosis. 3. Live vaccines delayed 11 months after IVIG. Interference with immune response. 4. Ongoing fever means recurrence. CliniqueRN tip. After IVIG means no live vaccines for 11 months. MMR varicella. Question 4. Congenital heart defect with pulmonary congestion. An infant with a VSD is irritable, tachypnic, and has poor feeding. Which finding indicates worsening heart failure? 1. Weight gain of 100 grams in 24 hours. 2. Heart rate 140 beats per minute. 3. Occasional cough. 4. Mild diaphoresis during feeding. The correct answer is 1. Weight gain of 100 grams in 24 hours. Rationale. 1. Rapid weight gain means fluid overload. 2. HR 140 normal infant HR. 3. Nonspecific. 4. Common symptom, not new worsening sign. CliniqueRN tip. For infants, weight gain means water gain. It's your earliest HF clue. Question 5. Patent ductus arteriosus, PDA. A newborn with a PDA receives Indomethacin, Indocin. What is the expected effect? 1. Close the ductus arteriosus. 2. Open the ductus arteriosus. 3. Increase pulmonary congestion. 4. Improve systemic perfusion only. The correct answer is 1. Close the ductus arteriosus. Rationale. 1. NSAIDs inhibit prostaglandin synthesis, which in turn causes closure of the ductus arteriosus. 2. Prostaglandins open ductus. 3. PDA closure improves, not worsens, congestion. 4. Closure improves both pulmonary and systemic flow. CliniqueRN tip. Indomethacin means indoor, closes the door. Closes PDA.
All right, quick break, because I need to show you something that can actually change the way you study for the NCLEX. This is our AI feedback system, built right into the QBank dashboard. After every quiz, you don't just get a score. You get personalized insights that explain why you miss questions, where your weak spots are, and how to fix them. For example, it tells you things like which subject areas need urgent review, whether you're rushing through questions and leaving test time unused, step-by-step recommendations like taking focus quizzes to sharpen delegation, prioritization, or clinical judgment. Instead of just saying you scored 60%, it literally gives you a roadmap to improve. And that's just one part of the QBank. You'll also get challenging NCLEX-style questions that test real critical thinking, a clean summary sheet that tracks your progress over time, and a built-in computer adaptive test system so you can practice under real exam conditions. This isn't just question practice. It's smart, AI-driven coaching that helps you study smarter, not harder. If you're serious about passing the NCLEX on the first try, check the link in the description and start using the QBank today.
Question 6. Post-cardiac surgery care. A child returns from open heart surgery. Which finding requires immediate action? 1. Chest tube drainage 20 milliliters per hour of serosanguinous fluid. 2. BP falling from 90/60 to 70/43. Pain score 8 out of 10. 4. O2 saturation 94% on 2 liters. The correct answer is 2. BP falling from 90 to 60 to 70 to 40. Rationale. 1. Normal post-op drainage. 2. Sudden hypotension refers to possible cardiac tamponade or hemorrhage. 3. Manageable, not life-threatening. 4. Expected. CliniqueRN tip. After cardiac surgery, low BP means low life. Always check for tamponade. Question 7. Congenital heart failure. A nurse observes an infant sweating and breathing rapidly while feeding. What is the priority nursing action? 1. Encourage longer feeds. 2. Allow rest periods during feeding. 3. Reduce feeding frequency. 4. Increase formula concentration. The correct answer is 2. Allow rest periods during feeding. Rationale. 1. Prolonged feeding worsens fatigue. 2. HF infants tire easily. Frequent rest arrow O2 demand. 3. Skipping feeds risks hypoglycemia. 4. High caloric formula may be ordered but not the first action. CliniqueRN tip. Infant feeding refers to cardiac stress test. Watch for fatigue means failure. Question 8. Coarctation of the aorta. Which assessment finding supports this diagnosis? 1. Bounding femoral pulses. 2. Weak femoral pulses. 3. Cyanosis of upper extremities. 4. Generalized edema. The correct answer is 2. Weak femoral pulses. Rationale. 1. Bounding in upper extremities, not femoral. 2. When blood flow decreases below the area of constriction, the leg pulses become weak while the blood pressure in the arms is higher. 3. Cyanosis not typical. 4. Not a main feature. CliniqueRN tip. Compare arm versus leg pulses. Strong arms, weak legs means coarctation clue. Question 9. Infective endocarditis. A child with congenital heart disease develops a new murmur and small, painful lesions on fingertips, Osler nodes. What is the likely cause? 1. Autoimmune disease. 2. Infective endocarditis. 3rd. Rheumatic fever. 4. Kawasaki disease. The correct answer is 2. Infective endocarditis. Rationale. 1. Doesn't cause lesions or murmurs. 2. A bacterial infection of the endocardium leads to the formation of vegetations, the appearance of Osler nodes, and the development of a new heart murmur. 3. Rheumatic fever means migratory pain, not fingertip lesions. 4. Kawasaki refers to mucocutaneous, not Osler nodes. CliniqueRN tip. New murmur plus fingertip lesions equals infective endocarditis until proven otherwise. Question 10. Rheumatic fever prophylaxis. Which statement by parents shows correct understanding? 1. He'll take penicillin for a few weeks. 2. He'll need penicillin injections for several years. 3. We'll stop penicillin once the fever is gone. 4. We'll switch to antibiotics only if symptoms return. The correct answer is 2. He'll need penicillin injections for several years. Rationale. 1. Too short. Prophylaxis lasts years. 2. Monthly penicillin for 5+ years to prevent recurrence and valve damage. 3. Stopping early risks relapse. 4. Prophylaxis is continuous, not symptom-based. CliniqueRN tip. Rheumatic heart means recurrent risk. Prevention lasts into adolescence. Question 11. Post-cardiac cath care. Which finding 4 hours after cardiac catheterization requires immediate intervention? 1. BP96/60. 2. Pulse +2 at affected leg. 3. Leg cool, pale, and diminished pulse. 4. Mild pain at site. The correct answer is 3. Leg cool, pale, and diminished pulse. Rationale. 1. Normal. 2. Normal perfusion. 3. A possible arterial obstruction can lead to a loss of tissue perfusion, which constitutes a medical emergency. 4. Mild pain means expected. CliniqueRN tip. After cath, always check distal pulse. Pale/cool means clot or obstruction. Question 12. Cyanotic episode during feeding. A newborn with transposition of great arteries, TGA, becomes cyanotic while feeding. What is the priority action? 1. Apply 100% oxygen. 2. Stop feeding and check airway. 3. Insert IV line for fluids. 4. Notify the provider immediately. The correct answer is 2. Stop feeding and check airway. Rationale. 102 won't fix circulatory mismatch if airway obstructed. 2. Feeding increases O2 demand. Stop feed, ensure airway open. 3. Later. 4. After stabilization. CliniqueRN tip. In infants, first stop the activity, then secure or fix the airway, and afterward provide oxygenation. Question 13. Hypoplastic left heart syndrome. Which nursing intervention supports systemic perfusion in this condition? 1. Increase oxygen flow. 2. Maintain patent ductus arteriosus. 3. Restrict fluids. 4. Encourage vigorous feeding. The correct answer is 2. Maintain patent ductus arteriosus. Rationale. 1. Extra O2 may close PDA and worsen condition. 2. A patent ductus arteriosus, PDA, allows systemic blood flow, so a prostaglandin infusion is administered to keep the ductus open. 3. Restricting fluids worsens perfusion. 4. Feeding tires infant, worsens hypoxia. CliniqueRN tip. Keep the ductus open means keep the baby alive. Question 14. Congenital heart block. An infant born to a mother with lupus has heart rate 60 beats per minute and pale skin. What is the nurse's best action? 1. Prepare for temporary pacing. 2. Administer oxygen by mask. 3. Give digoxin. 4. Start IV fluids. The correct answer is 1. Prepare for temporary pacing. Rationale. 1. Congenital heart block means pacing to maintain perfusion. 2. Oxygen supports but doesn't fix conduction. 3. Digoxin worsens bradycardia. 4. No impact on rhythm. CliniqueRN tip. Neonatal HR less than 80 plus poor perfusion means pacing, not meds. Question 15. Cardiac tamponade, post-op. A child post-open heart surgery becomes restless, tachycardic, and has muffled heart sounds. What is the priority? 1. Notify the surgeon immediately. 2. Increase IV fluids. 3. Give diuretics. 4. Obtain ECG. The correct answer is 1. Notify the surgeon immediately. Rationale? 1. Beck's triad, low BP, muffled heart sounds, JVD, refers to cardiac tamponade. 2. Temporary but not definitive. 3. Diuretics worsen hypotension. 4. ECG not first. This is an emergency. CliniqueRN tip. Post-op plus muffled heart sounds means tamponade until proven otherwise. Question 16. Pediatric SVT. A 5-year-old presents with HR 210 beats per minute, stable BP. What initial nursing action is appropriate? 1. Prepare for adenosine IV. 2. Begin chest compressions. 3. Apply ice to the child's face. 4. Administer epinephrine. The correct answer is 1. Prepare for adenosine IV, and possibly 3 as vagal maneuver if mild. Rationale. 1. Adenosine refers to drug of choice for SVT if stable. 2. Not cardiac arrest. 3. Secondary measure. Ice to face vagal maneuver can slow HR. 4. Epinephrine increases HR. CliniqueRN tip. Stable SVT means adenosine. Unstable refers to shock. Learn the split. Question 17. Cardiogenic shock. Which finding in an infant with heart failure suggests cardiogenic shock? 1. Cool extremities and weak pulses. 2. Bounding pulses and high BP. 3. Warm skin and tachycardia only. 4th. Increased urine output. The correct answer is 1. Cool extremities and weak pulses. Rationale. 1. A decrease in cardiac output leads to poor tissue perfusion, which results in cool skin and weak pulses. 2. Opposite of shock. 3. Incomplete picture. 4. Urine output decreases during shock. CliniqueRN tip. Cold hands indicate poor cardiac function, often described as a cold heart, which suggests decompensated heart failure. Question 18. Cyanotic heart disease. Which oxygen saturation finding needs immediate action? 1. 92%. 2. 88%. 3. 75% with cyanosis worsening. 4. 85% with calm infant. The correct answer is 3, 75% with cyanosis worsening. Rationale: 1. Normal. 2. Acceptable baseline for cyanotic heart disease. 3. Rapid desaturation and respiratory distress indicate a cyanotic crisis, which requires placing the infant in the knee-chest position, administering oxygen, and notifying the healthcare provider immediately. 4. Acceptable baseline if asymptomatic. CliniqueRN tip: cyanotic heart kids can live low, but not lower suddenly. Question 19. Rheumatic carditis. Which nursing finding is expected? 1. Bradycardia. 2. Friction rub and tachycardia. 3. Irregular rhythm. 4. Bounding pulses. The correct answer is 2. Friction rub and tachycardia. Rationale: 1. Bradycardia not typical. 2. Inflammation of the myocardium or pericardium results in a pericardial friction rub and tachycardia. 3. Irregular means AFib. 4. Bounding pulses are characteristic of a patent ductus arteriosus, PDA, and are not a feature of rheumatic carditis. CliniqueRN tip: rheumatic means rub plus rapid rate. Question 20. Pediatric cardiac arrest rhythm. During resuscitation, the cardiac monitor shows asystole in a 4-year-old. What is the first nursing action? 1. Begin chest compressions. 2. Defibrillate immediately. 3. Administer amiodarone. 4. Check blood glucose. The correct answer is 1. Begin chest compressions. Rationale: 1. Pediatric asystole refers to CPR plus epinephrine, not shock. 2. Asystole non-shockable. 3. For VT/VF, not asystole. 4. Delayed to life-saving action. CliniqueRN tip: flatline plus no pulse means start compressions. Don't waste seconds. And that's a wrap on today's high-yield pediatric emergencies. How did you do? Drop your final score in the comments. Let's see who's ready for test day. If you found this helpful, don't forget to like, subscribe, and share this video with your study group. Want more practice? Click the link at the top corner for your daily NCLEX test at CliniqueRN. Until next time, stay curious, stay confident, and keep nursing smarter.